Hello, I'm Colonel Thomas Bundt, Commander, Madigan Army Medical Center, and I'm here with Dr. Cristin Mount, and we're here to talk to you a little bit about the changes here at Madigan during the COVID-19 outbreak. Dr. Mount,
Sure.
I heard there are some changes in terms of access to the facility. Maybe you can talk to us a little bit about those changes.
Absolutely, sir. So in an attempt to further protect our patients and our staff, we have changed access to the building and identified 4 separate entrances that are available. The first and most important for our patients to know is that the emergency room is available for anybody that has a medical emergency that needs to be evaluated, and we would still like patients to go to the emergency room if they need medical evaluation. The other entrances that are open to both staff and patients are the medical mall entrance, the inpatient tower entrance, and the west entrance, which is the door located next to the emergency room under the covered walkway. At those entrances, we'll be asking patients to perform hand hygiene, either hand sanitizer or hand washing. We'll have hand washing stations present. And we'll be asking screening questions that are designed to help us determine if patients need enhanced screening, at which point we'll direct them to that location.
Is that the same change that's taking place at the outlying clinics in the Madigan Annex?
Yes, sir, it is. So we've asked all the outlying clinics to proceed to single entry points for staff and patients where they should be doing the same thing.
Right.
Asking our staff and patients to complete hand hygiene and asking basic screening questions. All of the outlying clinics have identified areas for enhanced screening if it's determined that that's necessary. And we're in the process of doing the same thing at the Madigan Annex.
Now, you would agree that this is probably a very fluid situation, and there is the likelihood that this could potentially change in time. Is that still the case?
Yes, sir. As has been evident over the past 2 weeks, things change rapidly, and we are poised to change with the guidance that is coming from our experts in Pierce County, Washington State, and certainly our own preventive medicine team. So we may see additional entry control points, we may see additional hand washing and hand hygiene opportunities, and we may see changes to some of the screening questions that we're asking.
Is there a potential also for a reduction in those entry points based on the current situation?
Yes, sir. So based on the current situation, it may become necessary to control access to our medical facilities in a more defined way, which could mean decreased entry points or alternate entry points that are better for patient and staff flow.
Understood, understood. You know, it's been very enlightening to see the staff and the patients actually come together in a lot of these situations and to share with each other their thoughts and to garner that appreciation for the quality of care that they're going to get here, as well as the opinion of the providers that are trying to take care of them. And during these times, we need to maintain that level of professionalism and espouse same. Do you have any thoughts or comments on that for both the patients and the staff as they're running into these challenging times?
So we do recognize that these are unusual times and frustrating times, particularly if patients are worried and staff are trying to get to work to take care of our patients. And we just ask that everybody please remain polite and cooperative, and to please follow the directions of the soldiers that we have stationed at these entrances, because what we're asking people to do is really to protect themselves and our staff and each other from the current events.
Couldn't have said it better, Dr. Mount. I want to thank you for your time today. Really appreciate it, and hopefully our audience is getting a lot of information from this conversation.
Thank you, sir.
Care with compassion.